Now we will tell about the electrocardiography. Okay, ECG, cardiac hypertrophy and enlargement. For example, what will we see on the ECG if there is hypertrophy and enlargement in the right in the ventricle or atrium, etc. Okay, so first of all, the enlargement seen in the atria. For example, if the in the atria if there is enlargement, what will happen? For example, hypertrophy, secondary in the ventricle. For example, increased thickness. What is the hypertrophy? Actually, hypertrophy is actually increased thickness or dilation, or if for example increased volume of the chamber. There are two things. Enlargement means one thing is hypertrophy, increased thickness of the muscles, okay, and another is the increase in the volume of the increased volume, okay, of the chamber. So we are talking about the increase the hypertrophy. So right atrial enlargement, for example, larger larger p wave is produced. For example, lead v1 larger. If there is the atrial enlargement, what will happen in the atrial enlargement? The things that happen is the you have to understand that lead v1 v2 are more than 1.5. They give the voltage more than 1.5, okay, and lead 2 3 avf give you voltage more than 2.5. These are the important indications, okay, that the right atrial become enlarged, okay. For example, toward this side the right atrium, okay, and I have already tell that lead v to the right side there are v1 v2, okay, and lead v2 lead v2 lead 3 and avf. These are actually to this side, okay, and so there will be the signal, the electrical signal and the electrical voltage more than 2.5 millimeter, okay. Now another thing is the cause stenotic. For example, if there is a stenotic here, so what will happen? The tricuspid difficult to eject blood, so right atrial enlargement will be happen, okay. Now about the left atrial enlargement. What is about the left atrial enlargement? If the left atrial become enlarged, what will happen? You have to see the lead 2. This is lead 1, this is the lead 2, and this is the lead 2. So you have to see the lead 2, and there is a things separation of two piece. There is a separation of two piece like this, okay. Another is it is actually 110 millisecond, greater than 110 millisecond, that this wave become increased 0.01 second, greater than 0.01 second. This is important indication. Another thing is also the biphasic wave. There is also a biphasic wave. For example, this is actually the biphasic, one phase, two phase, biphasic wave, okay, and 1 millimeter, actually greater than 1 millimeter. The area, the height of this is actually greater than 1 millimeter, okay. Now this is actually, and you have see, you are seeing here in the lead v1. In v1 it is actually show you biphasic wave, and the lead 2 it show you the separation of the p wave. You have to remember, if the left atrial, this is your left atria. If left atria enlarge, you have to see lead 2 and lead v1, okay. There are the separation of p waves, okay. And another, in the v wave there are biphasic wave. If this pattern is seen, there will be left atrial enlargement, okay. Now right ventricular hypertrophy. What Now about ventricular hypertrophy are two types. One is the right ventricular, another is the left ventricular. So right ventricular hypertrophy is actually, for example, right ventricle become hypertrophy and balance the left ventricle. For example, you have, if there is the right ventricular hypertrophy is happen, what will happen? You have to see the lead v1. In the lead v1 there are mostly negative. They become actually lead 1 become mostly negative. Lead, you have to see that this is lead 1, this is lead 2, this is lead 2, this is lead 3. And when right ventricular hypertrophy occur, okay, there will be right shifted, right axis deviation will also be occur. For example, this is your heart, okay, this is your heart, and Now here is the right ventricular hypertrophy occur. This side is become large. Okay, the thickness. So it means there are myocyte are still. So when depolarization happen, so it create more positive, so it create more charge. Okay, and it create more charge, so it means that to the right side the deviation, the right side will be more positive. Okay, so it means there will be right axis deviation. It will show right axis deviation. Okay, right axis deviation, that to the right side the voltage become more. Okay, the signal become more. Now, so first of all, you have to lead v5 v6. If you see the lead v5 v6, there is the dominant dominant S wave. There will be a dominant S wave is present. Q or S dominant wave is present. Another is the in lead one. Lead one is more positive. Lead one is more positive. How? For example, this is lead one. This is lead two, and this is lead. This is a lead. This is lead three. This is lead three. Okay. So now this is actually left side lead more positive. For example, this is lead 1, this is lead 2. So lead 2 become, they move toward the right side. Okay, toward the right side. If this is left, right ventricular hypertrophy occur, there will be right axis deviation, cause pulmonary hypertension. For example, right axis deviation will occur, and this also called pulmonary hypertension. For example, from the right side, the blood go toward the pulmonary side, and there will be pulmonary hypertension. Pulmonary hypertension will also be created. Okay, and in the lead, you have to see the in the lead one mostly it is negative, but if there is right ventricular hypertrophy, there will be RS ratio. If you see the RS ratio greater than 1, it will give you RS ratio greater than 1, mean it is positive. Okay, 7 millimeter in the lead one, it become positive. After that, if you see after the right ventricular hypertrophy, it become positive. Okay, now come here to the left ventricular hypertrophy. In left ventricular hypertrophy, there is actually this is, you see the lead v1 v5 v6. Okay, so actually it has ST elevation. Here will be ST elevation in the left ventricular hypertension. If there is left ventricular hypertension, the left ventricular hypertrophy occur, and there is the in lead v1, there is also ST elevation. Okay, so up to this we have explained this. Another thing is, if you see the lead v5, there will be ST depression. This S will be depressed. Okay, and T wave inversion, QRS, T wave inversion. T wave inversion also happen here. Okay, now this is all about the hypertrophy of ventricular.